Rolling. Okay, so can you start by saying your name, your team name, and why you're here?
Yeah. Hi, my name is Adithya, and my team name is RespirAID, and we're basically here to build a medical device which is looking at low-cost ventilation assist that is trying to bridge the gap between the existing manual ventilation and the sophisticated devices which are the ventilators in the hospitals. So we are trying to cater to secondary hospitals which otherwise cannot afford these expensive ventilators and maintain them.
And is this something you're passionate about?
So I'm passionate about disruptive technologies which has a huge impact on the overall population. So the projects that I work on are usually has a significant impact, and RespirAID, I believe, has a huge impact in saving lives across the world in the developing space.
And how exactly does your project improve healthcare around the world, around India? And how will this help patients?
What's the last one again?
And how will this help the patients around the country?
Sure. So there are two sets of populations. One are the rural and the semi-rural or semi-urban, and the other set is the urban populations. So the rural, semi-rural, and urban, semi-urban populations are having issues with access to healthcare, especially these ventilators that are otherwise available in expensive corporate hospitals or in tertiary hospitals which are owned by government but are very few in number. So we are trying to cater to the issue of access through our device RespirAID for this population, and for the other population, that is the urban population, trying to bring down the cost significantly through volumes and thereby give them access to this device.
And do you think, looking forward, that you guys are helping, and are you excited for the future of this project?
Yeah, definitely.
Yeah.
So this project actually has a significant impact. We've surveyed and spoke to about 76 doctors in the last 3 months, and we found that it has every single person we've interviewed have told us that this has a critical impact, at least at one point in their overall clinical career they've experienced this issue, and they would want this issue to be solved.
And so Camtech has helped you along the way with the accelerator program?
Absolutely.
And can you explain a little bit about that?
Yeah. So Camtech has been great. I've known Camtech for a while now, and I think what they're doing is creating the ecosystem at this point, building the 0 to 1 where the capacity is currently still building. So in India, the real capacity started building in 2007 when there were centers, academic centers that were focused on innovative technologies that were set up for biomedical engineering. And what Camtech is right now doing is trying to scale this model by bringing in engineers, designers, artists, and doctors, and different players on one platform, and bridging the gap between them and making them interact and bring ideas to prototype, proof of concepts, and then to reality. If you look at in the 1800s and 1900s, real ideas came from coffee shops and bars. So I believe these early interactions and between different groups sort of lead to great innovations that are otherwise not being solved in terms of in the country at this point.
Perfect. Okay, thank you guys.
Thank you.
That was great.